Hello students, in the last session we seen the sympathomimetic agents. In detail its classification, direct acting, indirect acting and the mixed acting. Now moving towards the next point as per the syllabus, that is the adrenergic blocker or adrenergic antagonist. And all these notes are as per the PCI syllabus. So which are the important one? So refer everyone. So starting with our topic, adrenergic antagonist. These are the drugs which blocks the effect produced by the sympathomimetic drugs. So the sympathomimetic drugs which are produced, so these agent blocks such a effect. That's why it's called as a adrenergic antagonist. On the basis of its mode of action, these are classified into the two classes, alpha adrenergic blockers and beta adrenergic blockers. Alpha adrenergic blockers, these drug antagonizes the effects produced by the drug acting on the alpha receptors, and second one is that beta adrenergic blockers, these drug antagonizes the effects produced by the drugs acting on the beta receptors. Means what? Here some drugs antagonizes the effects directly by acting on the beta receptors, that is the beta adrenergic blockers, and some drugs which antagonizes the alpha adrenergic receptors action, that is the alpha adrenergic blockers. Now moving towards the next slide, that is the first alpha adrenergic blocker. So we'll see its classification. So the alpha adrenergic blocking drugs or the agents are classified into the two types, non-equilibrium types and the equilibrium types. Non-equilibrium types again having a single class, that is a beta haloalkyl amine having the drug phenoxybenzamine. And now the second equilibrium type is going to be divided into the three subclasses, non-selective, alpha 1 selective, alpha 2 selective. So again the non-selective is divided into the three subclasses, ergot alkaloids, imidazoline, miscellaneous, and the fourth one hydrogenated ergot alkaloids. Now each and every drug from each class that we will see in the upcoming slides. In case of the non-equilibrium, there only one drug, but in case of the equilibrium type of the alpha adrenergic blocker, there are the mainly three types, and the first non-selective again going to be divided into the four subtypes. Now each class with its a single example of the drug that we will see in the upcoming slide. So the first is the non-selective type. So the alpha adrenergic blockers with the non-selective blockers or alpha adrenergic agonist. As I told, example is the haloalkyl amine. So here structure is as I shown. In that the haloalkyl amine, the main drug which is come, that is the phenoxybenzamine. Phenoxybenzamine. Regarding its mechanism of action, it is an irreversible alpha blocker and it blocks the alpha 1 and alpha 2 receptors. So it is an irreversible alpha blocker. So it blocks both the alpha 1 and alpha 2 receptors. Uses, it having the two use, that the first it is used in the hypertension and second it is used in the urinary retention. Now the second drug, second class from this alpha 1 adrenergic blocker. The first class that we see in the non-selective alpha adrenergic antagonist. Now the second class, that is imidazoles. Under it we have to study pentolamine or tolazolamine. Pentolamine or tolazoline. So here we will take the example of tolazoline, that is a imidazoline class. So tolazoline Its synthesis is as I given here. Benzyl cyanide treated with the methyl hydroxide in presence of HCl. So there is a formation of ethyl 2-phenyl acetate amide hydrochloride. Again it will treated with the ethylene diamine. Ethylene diamine, it produces toluazoline. Mechanism of action: it is an competitive inhibitor of the alpha receptor and its structure is similar as like the alpha agonist. So it binds reversibly with the alpha receptors and block the action of alpha receptors. Uses: these are used in the pulmonary hypertension in the newborn child. It is used as a vasodilators. It is used to antagonize the overdose of clonidine. Means when the overdose of clonidine is happened, at that time toluazoline is used. Now next type or the class of the alpha adrenergic antagonist is alpha 1 selective antagonist. So on the basis of name, it has affinity for the alpha receptors, which is 1000 times more than the alpha 2 receptors. That is the important thing. Alpha 1 selective antagonist having the affinity for alpha 1 receptor, which is about 1000 times more than that of the alpha 2 receptors. From this class we have to study the drug prazosin. From the alpha 1 selective category, we have to study the drug prazosin. Structure is as I shown here. Its use: see, regarding the prazosin, it is used in the management of hypertension and heart failure. It is used in the management of hypertension and heart failure. It is used in case of the Reynolds syndrome. So what is the Reynolds syndrome? It is a disease which is characterized by the spasm of the arteries. So when the spasm of the arteries is happened, at that time Reynolds disease is to be generated. Now the next one is the hydrogenated ergot alkaloids. So the next class from this category is the hydrogenated ergot alkaloids. So structure is as I shown here. Mechanism of action: it is an the antagonist of alpha adrenergic receptors, means it also blocks the action of alpha 1 adrenergic receptors. Use: it is used in the treatment of migraine. Again, the medication of overdose, headache. It is also used as a vasoconstrictor. Now moving towards the next, that is the beta adrenergic blockers. As we see in the first, alpha adrenergic blockers. Now second one is the beta adrenergic blockers. First of all, we will see regarding the information of beta adrenergic blockers. These drugs, as I told, antagonizes the effect produced by the drugs which are acting on the beta receptors. These are further classified into beta 1 selective, beta 2 selective and the non-selective group. Now the first one, SAR of the beta blockers. It again divided into the two classes according to its structure: aryl ethanolamines, aryloxypropanolamines. Aryl ethanolamines and aryloxypropanolamine. So first we will focus on the SAR of aryl ethanolamines. The basic drug for this category is isoproterenol. As I shown the structure here. So see the first, the phenolic OH group is important for agonist activity. So as these two phenolic OH group, these are important for its agonist activity, means its agonist activity. Next one is what? The two carbon chain must be there for their activity. It should not be more than 2 or less than 2. So see, the two carbons, as here, these two carbons are not more than 2 or not less than 2 in order to have its antagonistic activity. Next is the phenyl ethyl hydroxyphenyl ethyl groups are added to the N of beta blocker, means amino group of the beta blocker. For which purpose? For its beta blocker activity. Phenyl ethyl group or the hydroxyphenyl groups are added at the amino position in order to have the blocking activity. Cyclic alkyl substitution provides better activity at N atom. So here the cyclic alkyl substitution. So at this position, amino group position, when there is a cyclic alkyl substitution is there, so that will provide the better activity. And the last one, the two hydroxy group attached to the phenyl ring. If see these two phenyl hydroxy groups are replaced by the methyl sulfonamide, so it will increases its activity. So the two OH group attached to the phenyl ring, if replaced by the sulfonamide group, that leads to the increase in activity. So this is the simple SAR of the first category, that is a aryl ethanolamines, including the basic drug isoproterenol. Now the second category, SAR of aryloxypropanolamine. SAR of aryloxypropanolamine. So see, under this, the basic drug for this category is a propranolol. Okay. So see, the structure is as I shown here. After this, we will see its SAR. The OCH2 group. So this one, the OCH2 group is placed between the aromatic ring and the ethanolamine side chain, which is important for its activity. Means this aromatic ring and this is the further which ring? Ethanolamine side chain. So in between these two, the OCH2 group is placed for its better activity. Seconds are that the most of the derivatives have substituted phenyl ring in place of naphthanyl ring for its better activity. So here we should have the substituted phenyl rings in place of the naphthanyl ring for its better activity. Third point is that the alkenyl and alkenyl oxy groups, when present in the ortho position on the phenyl ring, it gives good beta 2 antagonist activity. Okay, so when this alkenyl or alkenyl oxy group were present in the ortho position here, so this group, complete group, when present on the phenyl ring at the ortho position, that produces the good antagonistic activity. The next one is that the substitution of OCH3. After that, the next is C-methyl group, OCH3 group and the nitro group on the phenyl ring, generally done at the 2 and 3 position for its better activity. So all these methyl group, OCH3 group and NO2 group, it should be done on this phenyl ring. Okay, it should be done at this phenyl group, mainly in the second and third position in order to have its better activity. And the last one is that the isopropyl and tertiary butyl groups present at the amino group provides nucleophilicity to the amino groups. Okay, so at the last, the isobutyl groups and the tertiary butyl groups, so this one at the amino group, isopropyl and tertiary butyl groups. When these are present, so that will provides a nucleophilicity to the amino group and which is most favored. So this is a simple and short SAR of aryloxypropanolamine including the drug propanolol. Now some of the beta blockers from this category, that is the beta blocker category. First is a propanolol. Structure as I shown here. Its mechanism of action, it is a non-cardioselective beta adrenergic blocker. Non-cardioselective beta adrenergic blocker, and its action is due to the decreased renin release and reduced cardiac output, decreased peripheral resistance. So its action is due to the decreased renin release, cardiac output and peripheral resistance. Now the C synthesis here. First in this synthesis, the alpha naphthol treated with the epichlorohydrin. So this is the structure of epichlorohydrin in presence of the base NaOH. The intermediate is obtained and that intermediate is treated further with the isopropyl amine. So this is the isopropyl amine to obtain the propanolamine or propanolol. Last, that it is used in the treatment of hypertension and in cardiac arrhythmia. So this is the first drug from this beta blocker category. Second is the atenolol. Regarding the atenolol mechanism of action, it belongs to the drugs of the class beta blockers. It works by blocking the action of certain natural chemicals in the body such as epinephrine. So it's having its blocking action due to the presence of natural chemicals like the epinephrine, and it's also have its action on the heart as well as the blood vessels. It is used in the management of hypertension, angina pectoris and the symptoms of alcohol withdrawal. Means the patients who wish to withdraw or wish to stop the habits of alcohol consumption, at that time atenolol is preferred. Again, it is given in the emergency treatment of the cardiac arrhythmia. Now the next drug from the beta blocker category, that is a betaxolol. So see its mechanism of action. It is selectively blocks the catecholamine stimulation of beta 1 adrenergic receptors which is present in the heart and cardiac smooth muscles. So betaxolol, how it acts? So first it blocks the catecholamines which stimulates the beta 1 adrenergic receptors in the heart and the vascular smooth muscles. Due to this, what happens? There is a reduction of heart rate, cardiac output, again the systolic and diastolic blood pressure. Uses: it is used in the treatment of hypertension and management of the glaucoma, that is the eye disorder. Fourth drug from this category, that is the beta adrenergic blocker, ismolol. Structure as I shown here. Mechanism of action, it works by blocking the beta adrenergic receptors, especially in the heart, and due to which there is a decrease in the force of rate of heart of contraction. It is used in the treatment of supraventricular tachycardia. Next, it is used in the management of arterial fibrillation. Now the supraventricular tachycardia means it is an irregular, fast or erratic heartbeat, and arterial fibrillation means what? It is an irregular and very rapid heart rhythm that leads to blood clots in the heart. So all these drugs, and the next, that is a labetalol. So these drugs comes in the beta adrenergic blocker, means their first mode of action is that they blocks the beta receptors. Okay, everyone, it should consider. Regarding the labetalol, the mechanism of action, it is a non-cardioselective beta blocker. What is this? It is a non-cardioselective beta blocker and acts as a competitive blocker on both alpha and beta receptors. It works by relaxing the blood vessels and slowing the heart rate to improve the blood flow and decrease blood pressure. It is a non-cardioselective beta blocker and it is a competitive blocker for the both alpha and beta receptors. Uses: it is taken orally in the treatment of hypertension and intravenously in the treatment of severe hypertension. Orally for the treatment of hypertension, intravenously for the treatment of severe hypertension. Now the next drug, that is a carbidiol. Carbidiol drug structure as I shown. It is used in the management of CHF, congestive heart failure, and in hypertension also. So with these students, we completed our adrenergic antagonist category, including alpha adrenergic blockers and beta adrenergic blockers with its SAR and important drugs as per your syllabus and as per exam point of view. So thank you everyone, and you should check out each and every video from my subject which is as per the PCI syllabus. Thank you once again.